Live. So good afternoon. Welcome to voting list number 2. This is our second time voting. It is Friday, February 9th at noon, and this is the Health and Government Operations Committee. I want to thank the committee for a week of very long hearings and hard work, great questions, and we really appreciate each and every one of you. Is there a motion for the withdrawals? It's been moved in second. Any objection? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, we now go to House Bill 39. The sponsor is Delegate Lewis, Residential Service Agencies Reimbursement Personal Assistance Services Home Care Worker Rights Act of 2024. It was favorable. It is Aaron and Bagnall. Aaron.
This bill provides that the Maryland Department of Health may reimburse a residential service agency for personal assistance services only if the services are provided by an individual who is classified as an employee. It was in the Public Health and Minority Health Disparities Subcommittee, and there are no amendments.
Delegate Bagnall.
Madam Chair, we had a great discussion on this. This bill is in the same posture that it was when we passed it last year. There were some questions about if the federal compliance and this bill complies state law to the federal guidance. It passed not unanimously.
Is there a motion? Is there okay? Is there a discussion on the bill? Seeing none, all those in favor say aye. Any opposition? Can you raise your hand, please, so that staff can see it? You got it? Thank you so much, everyone. The bill passes. We have House Bill 42. It's a departmental bill, Public Health Services and Protections Revision. It was favorable. It is Aaron and Bagnall. Aaron.
This is a departmental bill. It aligns state law with federal law, prohibiting the sale of tobacco products to all individuals under 21. It authorizes MDH to reallocate projected unspent CRF cancer grants awarded to a county for cancer programs to another county. It shifts responsibility for the cost of emergency medical treatment for an abused or neglected child from MDH to the Governor's Office of Crime Prevention and Policy. It repeals the requirement that the Secretary of Health appoint and convene an expert panel on child abuse and neglect, and it repeals a duplicative reporting requirement. There were no amendments.
Delegate Bagnall.
Thank you, Madam Chair. We had a great discussion. There were questions about what reallocation of funds meant and what it looked like. The department was there to answer those questions, and it passed unanimously.
Wonderful. Is there a motion? It's been moved and second. Any discussion on the bill? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Is unanimous. We have House Bill 230, Motor Vehicle Administration, Theft Certificates, Issuance of Copies is a departmental bill. It's favorable with amendment, and it is Aaron and Delegate Kerr. Aaron.
Actually, there are no amendments, and it didn't go to subcommittee.
Okay, yeah, I forgot about that. Yes, it did not go to subcommittee. This is the one that everyone wanted to move on the spot after she gave testimony. So is there a motion? Second? Is we moved in second. Any discussion on the bill? All those in favor say aye. Aye. Any opposition? It's unanimous. Thank you. No, it's a mistake. It's favorable. We didn't, yeah. House Bill 289, Delegate Kerr, State Contracts Prohibited Provisions. This is favorable with amendment. It is Lindsay and Delegate Kerr. Lindsay.
This bill prohibits state contracts from including specified provisions that generally restrict the power and rights of the state. If a contract includes a prohibited provision, the provision is void and the contract remains enforceable as if it did not contain the provision. A state contract that includes a prohibited provision is governed by and must be construed in accordance with state law, regardless of any term or condition to the contrary within the contract. The bill applies prospectively only and may not be applied to or interpreted to have any effect on or application to contracts executed before its effective date or to renewals or extensions of those contracts. There's an amendment on page 1 in your packet, which prohibits only provisions that require the state to indemnify, defend, or hold harmless another person if there is no appropriation of state funds for that purpose. And this was considered in Government Operations Subcommittee.
Delegate Kerr.
Thank you, Madam Chair. This bill was held for a week due to some concerns from the builders and contractors. And
Yes.
we met with them and worked out all of their concerns, and the amendment is their proposed language change. So I move the amendment.
It's been moved in second. Any discussion on the amendment? Seeing none, all those in favor of the amendment? Aye. Any opposition? On the bill as amended, is there a motion? It's been moved in second. Any discussion on the bill as amended? Seeing none, all those in favor say aye. Any opposition? Seeing none is unanimous. Thank you for your work and for taking their concern into consideration. Excuse me? Oh, yes, since it's favorable with amendment, great suggestion, Delegate Woods. Who does not want to be on the bill? Delegate Olson. Okay, thank you. House Bill 358, Prince George's County Delegation, Prince George's County Work Group on Health and Wellness, PG 49-24. It is favorable. Aaron and Bagnell. Aaron.
This bill establishes a work group on health and wellness in Prince George's County. There was an amendment that was added in the Public Health and Minority Health Disparities Subcommittee that adds the director of the Prince George's County Department of Parks and Recreation to the work group.
Bagnell.
Thank you, Madam Chair. The amendment was proposed at the hearing. We did get a letter from the county executive in support. There were no questions and it passed unanimously.
And the county is staffing, correct? Not the
the county
Department
is
of Health.
staffing.
Okay, great. Any discussion from anyone? No, there's no, there's an amendment? Okay, I'm sorry. Okay, so it's favorable with amendment. All right, so the amendment has been moved and second. Any discussion on the amendment? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. Any discussion on the bill as amended? Seeing none, all those in favor say aye. Any opposition? Seeing none, is unanimous. The bill passes. Does anyone want to be added to it? Can you on a? It's a delegation bill, so probably not. All right. The last bill for us to vote on is House Bill 390. Delegate Henson, Commission on African American History and Culture Museum name change. That is favorable, and it is actually Lindsay and Delegate Kerr.
This bill alters the name of the Banneker Douglas Museum in Annapolis to be the Banneker Douglas Tubman Museum under specified provisions of state law governing the Commission on African American History and Culture, and there are no amendments.
All right. Delegate Kerr.
Thank you, Madam Chair. The bill was unanimous in subcommittee. Move the bill.
Second. It's been moved in second. Any discussion on the bill? Seeing none, all those in favor say aye. Aye. Any opposition? Who has a question? You're seriously? No, just kidding. Go ahead. To be able to get on there? Oh, we can do it. Let's do it.
Can we just add co-sponsors?
Can we?
Yeah, I mean, of course we can.
Okay. All right, so why don't we leave it alone and add the co-sponsor? Who does not want to be on it? Who does not want to be on it? Everyone wants to be on it. Please add us all. Thank you. Okay. No, the dates stayed the same. We're just gonna add our, we have time.
That way they actually have time to actually make their name and stuff with their materials.
Yes. All right, so what we're gonna do is, since we have time, we're gonna go ahead and add us all, okay? Thank you. Great suggestion. You can mess with me anytime. So actually, this concludes the real hearing for today, but please stay in your seats when we go down to do the assignments. Thank you so much.